Hello, I'm Joanne, a nurse specialist from the Marfan Trust. This short video aims to tell you a bit more about Marfan syndrome, why it's important to get a diagnosis, and how to go about getting that diagnosis. So, firstly, what is Marfan syndrome? Put simply, it's a disorder of the body's connective tissue, and it affects people of any race, gender, or ethnicity in equal numbers. It was described first by this gentleman, Dr. Antoine Marfan, back in 1896. In 75% of cases, it's an inherited genetic disorder. 25% of cases are the result of a spontaneous genetic change, and that means that you may be the first person within your family to be diagnosed with Marfan syndrome. Any child who has a parent with Marfan syndrome has a 50% chance of inheriting the syndrome. And for the scientific minded amongst you, it is caused by a change in the gene for fibrillin 1, which is found on chromosome 15. Marfan syndrome is rare. It happens in around 1 in 5,000 people worldwide. And this would suggest to us that there are around 15,000 to 20,000 people in the UK with Marfan syndrome. But unfortunately, around 50% of people with Marfan remain undiagnosed. Every year, usually in the UK, there are around 200 new cases diagnosed. So it's a disorder of the connective tissue. What is connective tissue? It's a substance found throughout our body. It's made of various different proteins, and it's basically the glue that holds our bodies together, our cells, our organs, our tissues. So it's a really important structure throughout the body. It provides the stretchy strength of tendons and ligaments around joints. It gives our blood vessel walls structure and strength, and it's also important in the eyes and the lungs. In Marfan syndrome, the substance that's particularly problematic within the connective tissue is fibrillin, and it's deficient. And that means that it accounts for the unusual stretchiness and weakness of the tissues throughout the body. So why is it important to get a diagnosis? One of the main reasons is to get the help needed to manage symptoms. There can be a huge variety of symptoms with Marfan syndrome, and they all need different treatments and management. Importantly, one of the most life-threatening problems of Marfan syndrome is dilatation of the aorta, the main blood vessel within the body. And it's really important that individuals have appropriate monitoring and medication if necessary. Sometimes surgery is required to treat this, and having the monitoring will mean that you can have timely treatment or surgery if that does become necessary. It's important to have a diagnosis because that can help guide your family planning or future decisions about having children with all the information available. And finally, the diagnosis gives you access to additional support and adaptations that might be needed to meet your full potential, both in school or college and in the workplace. So to make a diagnosis, there are several routes. And it's important to know that Marfan is a clinical diagnosis. You don't have to have a genetic test to diagnose Marfan syndrome. So it may be that you get a diagnosis from your doctor without having a genetic test. And these are the three main issues that doctors will be looking to do this. So two of the main features that are classic to Marfan syndrome are aortic dilatation or aneurysm and dislocation of the eye lens, and doctors will also take into account your family history. So just to explain a little bit more about aortic aneurysm, this picture shows you the aorta, which is the main blood vessel that leads from the heart to take blood around and supply the rest of the body. And in Marfan syndrome, due to the weakened connective tissue, you can sometimes get widening of the aorta at various different points, and this would be called an aneurysm, which needs monitoring, and if it gets too large, may require surgery to fix it. The other classic feature that we look for is called ectopia lentis, and this would be a dislocated lens in the eye. So you can see in this picture, the lens of the eye has moved upwards, and has been displaced. And these tissues down here are again connective tissue that is weakened and stretchy due to the lack of fibrillin and has allowed the lens to move out of place. The other thing that's important to think about is whether or not you have a family history. Is there someone in your family who has been diagnosed with Marfan syndrome? So these are the three things that doctors will be first looking for to make a clinical diagnosis. So for example, if you presented to your doctor and you were found to have both dilatation of the aorta and a dislocated eye lens, that would be enough to make a clinical diagnosis of Marfan syndrome. If you attended and you had aortic dilatation and a known family history of Marfan syndrome, again, that would be enough information for you to have a diagnosis of Marfan syndrome. Again, if you had an eye dislocation with a family history, the diagnosis could be made. Now, in some cases, you won't have all these criteria met, and in that case, the doctors may go on and look at other systems within your body and do a more complex examination and ultimately send you for genetic testing if the diagnosis requires genetic confirmation. So these are some of the other signs that doctors will be looking for. This isn't an exhaustive list of all the signs, but I'm going to talk through them. And these are called the Ghent criteria, or these are some of the Ghent criteria that doctors will look at, and they will score your systemic findings, so the body findings, on a score. And if you get a certain score, so usually over 7, they will use this as well to inform their diagnosis of Marfan syndrome. So starting at the top here, this gentleman has a dipped chest, a pectus excavatum. So as you can see, his chest is domed inwards. We can also see sometimes what people call a pigeon chest, so the chest can dome outwards. So some chest abnormalities are common within Marfan syndrome. Here you can see a picture of a gentleman with a curved spine, a scoliosis. This is something else that doctors will be looking at when they examine you for signs of Marfan syndrome. This young woman has some of the classic features of Marfan. You can probably see she's very tall and slender. She has very long arms. So often with a Marfan syndrome patient, their arm span may indeed be longer than their height. And that's something that will be measured. And also your measurement, the length of your torso in relation to your legs may be shorter. You can also notice with her, she has very long digits, and that's something else that will be looked at, long fingers. This picture shows us some stretch marks, and it's important to think about stretch marks in places where you wouldn't commonly get them due to weight loss or weight gain. And so you can see these stretch marks are appearing on somebody's back, which is quite an unusual place to get them. This picture in the corner here is another examination that will be looked at. So this is the roof of the mouth, the palate. And often in Marfan syndrome, the palate is very domed and very arched. And that is something that will be looked for, as well as crowding of teeth, which is sometimes common. This picture goes back to the aortic dilatation that I was talking about previously, and this is something that won't be picked up by examining you. This will be something that you need further investigations for, and this is a CT scan image. And so you can see here, this is the spine, and this structure here is the aorta. And as you can see, the aorta is much wider at this position than it is in this position. And so this should be the diameter of the aorta, but as you can see here, it's dilated significantly and will need careful monitoring and perhaps surgery to fix that, because if it gets too big, there's a chance it could tear. So that's something that needs looking at with further scans and investigations. These signs here relate back to the long fingers. And you can see here, this is a thumb sign. So if you fold your thumb into the palm of your hand, you can see here the whole first knuckle of the thumb is sticking out the other side of the palm. So that's quite a simple test to do. And here is the wrist sign. If you wrap your fingers around your wrist, does the thumb completely overlap the little fingernail? That would be a positive wrist sign. Again, there are sometimes heart valve abnormalities, and this is another test that would need to be assessed with further testing, with an echo scan, which is an ultrasound of your heart. Your doctor may be able to hear a murmur, but more information would be needed from an echo scan. So that's another really important test that may need doing. In Marfan syndrome in particular, the mitral valve sometimes becomes leaky and weak. Again, due to the weakened connective tissue, the valve can billow back into the wrong chamber and allow blood to flow the wrong way. And that's something needs to be assessed with an echo scan. Lots of Marfan patients describe hypermobility. Again, the weakened connective tissue means that they can have joint dislocations, double jointedness, they can do tricks with their joints, and this needs assessing by the medical team to see whether the degrees of hypermobility that are found. We already talked about the eye and the lens dislocation. Another thing that may be looked for is very severe short-sightedness. So that may be something assessed by your doctors or ophthalmologists. There are very many other signs and symptoms that doctors will be looking for, with skeletal findings that they will need x-rays and further examination. So there may be several tests that are required on this journey. So as I was saying, this affects all systems of the body, and it may be that many different specialists see you and don't actually put the pieces of the puzzle together. So it's really important that you get the pieces of the puzzle together so that you can move forwards with getting a diagnosis. You may have seen a cardiologist due to a murmur. Your dentist may mention that you have crowded teeth or a high arched palate. You may have been referred to a rheumatologist, a physiotherapist, or a surgeon due to joint dislocations, back pain, or joint pain. And this could be another clue to having Marfan syndrome. You may have seen an ophthalmologist due to problems with the eye, or your first port of call may actually be a genetic counsellor if you have a family member and you are referred for genetic screening following diagnosis in another family member. So all of these people may be instrumental in making the diagnosis, but they may need information from other specialists in order to confirm that diagnosis and refer you on to a specialist. So what can you do to try and streamline the process? I think if several people have mentioned Marfan syndrome to you, or you feel you have some of the features, it's reasonable to ask for a referral to a connective tissue clinic or to a genetics clinic. There is information on our website that you can download and take along to your GP if you're not sure how to approach that, and they should be able to facilitate that for you. It's really important that you get as much information as possible about your family history. It's really key if you have known cases of Marfan syndrome within the family. Something else that will be relevant to doctors is whether you have any unexplained deaths in your family at a young age. And by that, I mean less than 50. These can be really difficult things to bring up again and talk about, but that information can be valuable because they can look into the causes of death, which may give them further clues about the diagnosis. And if you have any death certificates, do take them along as well. If you have any photos of your family members, they might be useful again to look for other similar features. You often need to advocate for yourself or for your family member if your doctor is reluctant to refer you. You can ask for a second opinion, and you can ask again for a referral. It's a rare condition, so people may be reluctant to refer you or may not have the knowledge they feel that they need to refer you. And in that case, you can ask us for advice. I think you need to manage expectations if you are moving down the process to obtain a diagnosis. As you can see, there are probably lots of different tests that you're going to need. There can be a long wait for appointments and results to come through. And if you are referred to a genetic clinic for blood tests, the blood tests take at least 3 months to be returned. So this isn't something that's going to happen quickly, and it requires patience and attending appointments and getting all the information together that you need. I think whenever you go and see a specialist, take along all your information and test reports. Like I said, there may be lots of different specialists involved in your diagnostic journey. You may have reports from a cardiologist, from a rheumatologist, from an ophthalmologist. Bring them along to every appointment because they will help the doctors and the clinicians put the pieces of that puzzle together. Write a list of questions you want to ask. Appointments can often be rushed. The doctors are trying to give you lots of information, and there may be things that you specifically want to know. So sit down and write them when you have time to think clearly. Also, don't be afraid to take notes when you're in the clinic appointment, because you will be provided with a lot of information and it's difficult to retain all that in a stressful situation. Finally, I would say that a genetic diagnosis like Marfan syndrome can have implications for other family members. So you may end up being encouraged to advise further family members to have testing, and genetics clinics and services would certainly help you with that process. Finally, it's worth being aware that there are other related conditions, connective tissue disorders, which have a lot of overlapping findings with Marfan syndrome. If doctors aren't sure about your diagnosis, it may be that you are referred for genetics to try and get a concrete diagnosis, and you may end up with one of these different conditions, Loeys-Dietz, Ehlers-Danios, or a condition more linked to just the aortic aneurysm or the heart side of the condition. It's important that they get the right diagnosis, because often management changes slightly and the way that we look after patients changes slightly. So it does mean that it's an important distinction that needs to be made. Thank you for listening to this video. I hope it's been helpful. There's lots more information on our website. We also have a helpline via telephone or email, and you can find us on Facebook, Twitter, and Instagram if you have further information. Please do get in touch if you need assistance or help with your diagnosis. Thanks very much.